If you have knee pain and it keeps coming back, well, here's why and how to fix it. Most people think that if you want to fix your knee pain, you just got to become a whole lot stronger. Maybe being able to do some more squats, or maybe even being able to do one on one leg like that. But here's the problem with just getting stronger. The muscles of your legs are simply pulleys, meaning if we strengthen them, they get better at pulling in a particular direction like this. However, as you'll come to discover in just a second, knee pain isn't just about that pulley becoming stronger. It's about something completely different. And other people think that you need to become more flexible in order for your knees to feel a whole lot better. But here's why that doesn't work either. Muscles are just pulleys, and if you make them more flexible, it doesn't change the way that joint necessarily moves. So what is the real reason that you have knee pain? And what is the thing that you need to focus on the most? And the word I want to teach you is stability. Stability of the knee joint. Now, the reason why most people have knee pain is because the knee is a hinge joint. It's supposed to go forward and backwards, just like this. But for most people, since we don't have good stability, the muscles, whether they're tight or loose, will pull the knee joint, twisting it a little bit from side to side, or applying more pressure laterally from side to side. And how you can see this is when somebody goes to bend their knee, whether they're walking up a staircase, standing up from a chair, doing a lunge, or anything like that, you'll notice their knee doesn't go forward and backwards over their toes like this smoothly. Instead, what it does is it wobbles inward, comes around, and moves more sporadically like this. And that is a clear sign that you don't have good stability. And so what we're going to focus on in this video is teaching you a simple progression of movements that you can practice in order to build your knee stability back, making your knees feel better permanently. Okay, now I'm going to take you through a series of different movements, each one a little bit more challenging than the last one. And how I want you to use this video is follow along to these movements and try to find the variation that feels like a good fit for you. And what this should feel like is you can do this with really good form, but it's a little bit challenging. Now what you're going to do is pick the variation that feels like the right fit for you, and you're going to do it for 1 minute on each side every single day. And once it starts to feel easier, and you start to feel like you have more stability on this movement, then go to the next variation up. If you follow along to this simple routine for, let's call it 30 to 60 days, I bet you your knees are going to feel so much stronger, so much more stable, and that pain that keeps coming back, well, it's going to go away. So let's get started with the most beginner variation, which you'll need a simple chair for right in front of you, just like this. Now this is called the staggered stance drinking bird. And what we're going to focus on is making sure that your knee stays pointed the same direction as your toes. It doesn't wobble from side to side. And then second, that we're properly loading the hip muscle and activating these glute muscles right here. Because these muscles on the outside of the hip, well, guess what they do? They externally rotate the leg, creating stability inside the knee joint, which is oftentimes something that people are very weak at. So what you're going to do is stand in front of a chair. You're going to put one foot forward. That's the foot that we want to focus on. This is the leg that we're focusing on, the foot forward. One foot goes backwards where your toe is right at your heel right here. Now what we're going to do is have a nice tall posture. Our hips are straight forward and they're balanced. And we're going to put our weight back on this front heel right here. And we're going to slowly come forward, doing a soft bend of the knee and using our hands on the chair for support until you feel a nice stretch in your hamstrings and your glutes, okay? Now we're going to focus on extending the hips forward, slowly, all the way to the top position. And we want to focus on squeezing the glute muscle and making sure that the knee goes straight over the toes. It doesn't wobble from side to side. So it looks like this at full speed. Inhale down. Most of my weight's on this foot. Exhale up. Most of my weight still on this foot, especially on the heel. From a front angle, 1 foot forward, 1 foot back. We're going to put the weight on that front heel. Inhale forward. Weights on that front heel. Feel the hamstring stretch. Exhale. Squeeze the glute, extend the hip. Come back to the start position. The whole time, I'm trying to watch for those knee wobbles right there, okay? Now, this is a beginner variation. So if you're a complete beginner, practice this for 1 minute each day on each leg until it starts to feel much easier for you. Now, a more challenging variation, what we're going to do is we're going to begin to do this still in front of a chair, but this time I'm just going to use my toe on the ground for support, and I'm going to try to not use the chair in front of me for support either. So it's going to require a lot of balance. The first thing I want you to focus on as you really focus on this full balance movement is as I bring my body weight over that foot, I'm not tipping my body to the side like this. Because a tip body to the side forces internal rotation of the hip and is going to cause less stability of the knee. So instead, I imagine my nose and my belly button are a straight line, and I'm going to land it right over the center of my foot. Then I'm going to come up on my toe like this for support. I'm going to put my hands on my hips, and I'm going to do the same movement. Dropping the weight into my heel, soft bend to this knee right here, making sure the knees point to the same direction as the toes, pushing my butt back, and then pushing down into this heel and extending the hip forward just like this. From a side angle, you can have a chair in front of you for support just in case you lose your balance. Shift the weight over that foot. One toe goes up, nice tall posture. Then I'm going to push the butt back, put the weight on the heels, come forward until I feel that stretch. Remember to keep a nice flat back, no rounding the back like this. And then I'm going to push my heel into the ground, squeeze this glute muscle, and fully extend the hips just like this. Okay? So again, practice this variation for at least a minute on each side every single day until it starts to feel a little bit easier. Now the next variation, we're going to go to a full balance variation where we're going to lift this foot off the ground and only use it for support in the back position. So just like before, I'll show you again using a chair in front of me just in case I lose my balance. I'm going to shift my weight over that one foot, and this time I'm going to lift that foot all the way off the ground. Now, maintaining my proper posture, my good alignment here, not tipping to the side, I'm going to shift the weight back to the heels. I'm going to go forward until I feel a nice stretch through the glute and the hamstring, and I can use my toe back here for support, just to find good balance here and make sure the knee is still pointing the same direction as the toes. Then I'm going to push into the heel and come back up, and this time I'm going to lift my knee up nice and high and finish the hips, pushing the heel down to the ground still. Okay? I'm going to practice this motion just like this, just like we did before, for 1 minute every single day, and I'm going to pay attention to my knee wobbles. As we transition to full balance on one foot, you're probably going to see a lot more of this. A little bit of wobbling is okay. What we're doing is we're teaching the foot and the hip and the entire nervous system how to properly balance our body and how to properly activate those hip stabilizers that stabilize the knee as well. Now for the final variation, if you're able to do that one, then what we're going to do is we're going to bring our hands to our hips. And again, you can put something in front of you for support if you need to. We're going to shift the weight to one foot. And this time we're going to try to do that whole motion without touching the ground with our opposite foot while maintaining good posture. So again, weights on the heels. You'll even notice me wobbling a little bit more on this one because it requires more stability. And then pushing the heel into the ground and coming back to the start position the whole time, trying to maintain a nice upright posture and centering my body over that foot. So one more time, center my body over that foot. Hands on the hips, so I have a nice rigid upper body. Lift that knee up to the starting position. I'm going to reach that heel back, come through the heel of this front leg, tame those wobbles as your body wants to twist and move, and then press into the heel, squeeze that glute muscle, and extend the hip just like this. Practicing this in a slow and controlled fashion, focusing on the knees pointed the same direction as the toes, and having a good center of gravity over your foot is going to make such a huge difference on your stability in your knee that's coming from both your hip and your foot. And if you do this, again, for 30 to 60 days, gradually going up in levels, it's going to create more knee stability, and that knee pain that keeps coming back, well, you can pretty much say goodbye to it.